the knee, come down and around. Your patient can hold that for you. Your patient has arms. Come around, grab the end of this residual limb, come back up, so you're thinking about figure eight, and anchor right away. Once you've got that anchored, you're in pretty good shape. Now you want to keep coming distally, and your goal is to cover the entire bottom of the residual limb. And you can pull on it, place it wherever you want. Come up, you can stay on the residual limb, come down and around, cover it, come down and around, cover it. Now on your patient, and as well during the competency or practical, you can use 2 wraps. So I'll say when you do this, I'll say, okay, lift it up, let's see what we got. The end is covered nicely. I got a little hole there. See that little gap? So fluid would push through there, and the patient would get a little pocket of fluid. So now I'm going to say I would have tape. I would tape that, but now I got to say to my patient, you can let go there. Hold here for me. I'm going to go to my second wrap. Thank you. And now that would be tape, but because we don't have tape, I'm going to anchor right away. So I'm going there, coming around. Now on that turn right away, I probably already got that spot. Now come up one, come back down and around. And you can have your patient lifting their leg up and everything and checking and peeking, make sure you got everything covered. Come up and around, come down. And as you're coming to the end of the residual limb, you're putting a little bit more pull because we're trying to push the fluid up towards the patient's trunk. You don't want any wrinkles, so you smooth your wrinkles out. And I could take that there. Okay, now let's lift up and look. So now I got it completely covered. You can leave the popliteal space completely open. So that's okay. You don't have to cover the popliteal space. So let me do it again for you. So you're thinking figure eight. Patient can wrap that for me. You're thinking figure eight. You got to cover that distal limb. And then make sure you cover the posterior aspect of the limb. And pass that off because you got to hold this one. Okay. So I'm asking the patient, hang on there. Here comes my figure eight. I'm coming down around medial aspect. It doesn't matter. You could start medial and go lateral. That doesn't matter at all. Catching the end of the limb, coming up, and I'm going to anchor right away. So now that should be locked. Then I'm going to come back down. And now I can stay below the knee and do a couple wraps. Try and catch as much as I can. I can peek here, see what's going on. I got a big gap there. Get rid of my wrinkles. But you never want to go around like this, because then you would just be putting constriction here and you'd be pushing all the fluid to the bottom of the residual limb, so that would not be a good thing. Okay, let's see what we got now. Yeah, you could pull that a little bit, cover it up. Okay, as long as you're covered and you're coming down and up, down and up. Got the general idea? We'll have tape for you during the test. Your colleague will be holding the residual limb, and they can assist you if it's get a little bit more nerve-wracking during the practical. You drop it. We'll give you a new one, already rolled. We'll roll them for you, so don't worry about rolling them. You just concentrate on start to the top, come down, distally, come back up, anchor, and then you're just thinking about figure eights around this area. And you can keep coming back up here if you'd like. You're just going to use more rolls.